All right, so we're discussing baby kicks. What is normal and what is not normal. We want to understand your baby's movement in the womb. Yeah. Don't worry about the background. There's a lot of fireworks going on. So just do not be distracted, right? One of the most magical moments in pregnancy is that first um, feeling that mothers feel of their baby moving, right? For some women, they feel at first they'll feel it like a subtle flutter, right? For some others, they'll feel like a bubble movement of bubbles. While for some others, they'll feel a gentle tap, right? So depend on how you feel it. For some, they feel all everything I just said. But then one day, it becomes impossible to ignore. From that gentle tap, bubbly movement, or even flutter that you feel, it gets to a point where it has become impossible to ignore that something is really going on there. But along the line, this joy of sensing that something is moving inside you comes with questions. Comes with questions. Most women will ask, "Is my baby moving enough?" Women are very inquisitive creatures, right? Very inquisitive. Now, is my baby moving enough? Why is today quieter than yesterday? And are the kicks strong? If the kick is strong enough, is it good? If it's not strong, is it bad? Lots of questions that we have to answer. We have to answer because of how inquisitive pregnant women are, which is a good thing, right? Which is a good thing. But let's look at the whole story in details. So you want to hold on with your question after the discussion. We can answer your question. Is that okay? Right. So the first thing we should begin to talk about is when does the baby kick start? When does it start? Most women feel the movement anywhere around 16 weeks to 18 weeks. That's when their first experience with baby movement starts. And this bracket is actually for those who have been pregnant before, anywhere around 16 weeks to 18 weeks. Yeah. Now, for those who are priming, in other words, those who are pregnant for the first time, yeah, 41, no sign of labor, what can I do? Go and see your doctor. Go and see your doctor. Is that okay? So, those who are pregnant for the first time, right, the experience will be anywhere from 18 weeks to 22 weeks. But again, early movement will feel something like flutter, butterfly movement, or even gas bubble. That's what early movements would feel like. Now, these are early, how do they call it now? This early sensation is usually termed as quickening. So when you are asked, when was your quickening? That's what they're asking you. When did you start feeling the baby's movement? Is that okay? So that is quickening. So at this stage, you are having the movement. The movement will basically be irregular at this stage, right? And some days you feel them, and some days you don't feel them. These all are completely normal. Why? Because it's still early. Is that okay? Now, why do babies move in the womb in the first place? Why do babies move in the womb in the first place? All right, guys. If you're not tapping on your screen, I wonder why you are not tapping, and it's not fair to those who may just need this information. So please tap on your screen. All right. So why do babies move in the womb? Right. If you are listening to me, if you understood anything I said up to this point, please type in the comment section understood so that we can go on. I want us to communicate. Is that okay? All right. So why do okay, good. Yes, sir. Why do babies move in the womb in the first place? All right. Please note that babies' movements are not some random movement that occurs. Nah, it's not random. They happen for these reasons. Okay, I'm sure some people are coming for the first time. If you are not taking notes, you're going to miss a lot of things. So I'm sure you're writing because I usually like to bullet my points so that you will be able to remember. Is that okay? So the reason why baby move, that's what I want to itemize it so that you don't forget it. Are we ready? The reason why baby move in the womb. Are we ready? So while we are getting ready, if you have not followed me, follow me now. Follow me now. And by the way, I want to hit 10K followers before New Year, before January 1st. And I'm sure it's possible. So if you're not following me, follow me now so that we can say Happy New Year with 10K followers. Is that okay? All right. So why do baby move? Why do baby move in the womb? Yeah. Now this happen because the brain is developing. Oh boy. Those of you who have been here since last week, you already understand what I'm talking about. Because the brain is developing. And as the brain is developing, nerves are connecting to themselves and are connecting to muscle. And for every connection that happens, there's a firing. The body is just like can I unfollow so it counts again? you're, you're funny. You're funny. All right. So for every connection that happens, there's a firing that happens, and because it's just like an electrician trying to wire the house. So when they make the connections, what do? They test it. So the same thing happens as your brain nerves are connecting to themselves. There are firing that's happening as they connect to the muscle. There is firing that is happening. So um, the muscles are as the muscle also gets stronger and the firing gets stronger. So you begin to have the baby moving and stuff like that. So the baby basically is just practicing survival skills. So somebody asked the question, who taught babies? Yes, Chacha, remind me when it's time for question and answer. All right. So, somebody asked the question, who taught babies the things that they do? Some of the reflexes they do in the womb is a rehearsal for what they will come and do for the part that you didn't teach them. For example, who taught babies how to suck breasts? Nobody. Who taught baby how to breathe in and out? Nobody. Who taught baby how to swallow? Nobody. So they have always been rehearsing, and that forms part of the movement that you feel. The one part of what we call baby kicks. Is that so? Do you understand? So every kick, every stretch, every rolling is an exercise for life after birth. So you think you're the only one that goes to gym? The baby is also gymming. Right? So you see, we started all this from the beginning. So whether you are feeling the baby rolling, whether you're feeling the baby kicking, you're feeling the baby stretching, all that is just a rehearsal. It's gymming for after birth activities. And it's actually because The brain is connecting his nerve cells together and nerve to muscle. So it's a rehearsal and testing of what is being formed. Right. Again, even though that is just a blanket understanding, but you need to understand that these movements, kicks, changes over time. It's not the same tempo across pregnancy. Is that okay? In the second trimester, um, uh, what you have is the movements are light and playful. Yeah, the movements are light and playful. The frequency is usually varies day by day, and the baby has a lot of space to move in the second trimester. So the baby can stretch out their hand like this, and they really can stretch out their hand without touching the other side because there's enough room to do that. And in their movement and kicking, there's usually some long quiet periods, which is common. It does not mean that something is wrong with your baby. It's just that the pattern at this stage, you can have long quiet periods and so on and so forth, right? So at this stage, um, irregular movement is normal. Yeah, some days you feel the baby is busy doing only God knows what. Some other days you feel the baby is quiet. And I've had a lot of people come to the clinic say, "Oh, I don't understand. My baby is not moving anymore." The baby is actually quiet. Yeah, it's quiet. Nothing is wrong. Right. Now, by the time you get to 28 to 40 weeks, the pattern of kicks will change. Right? Christabel, so I'm talking to you. That is third trimester into term. Right? Now, here, the movement becomes stronger and more deliberate. So the baby can aim, where is mommy's heart? Let me punch in that direction. Boom. So it's a stronger kicks and movements, and it's even a more deliberate um kicks and movements, right? The kicks will turn into rolling, into pushing, into stretching. Sometimes your baby may just set its buttock and push forward. Some of you will feel like something very strong protruding from here. Your baby is just doing all that gymnastics. And you wonder, what is really going on there? Is it two people or one person? It's all about stretching. It's all about kicking. It's all about, sometimes it's responding to your talk, responding to light, responding to hunger. It's deliberate, right? Unfortunately, again, the baby has less space, right? He has less space and stronger kicks. You see the reason why some of you will shout, "Ouch!" In fact, some of you will even tap on the baby to behave. Is that not so? Pregnancy is a wonderful journey. That's why I want every woman to experience it. Because some of the nonsense talk you hear people say on social media is because they've not carried a human being. When they do, the way they think will change. Trust me. Right? Right. So important thing to know. Hello, Akua Otiwa. I see you. Important thing to know is movement does not stop. The movement will not stop. The baby is always moving. It's just that sometimes there's some quiet times, right? There's some quiet times. And they may feel different, not weak, not weaker. Don't feel that something is wrong. It's only when something is wrong, and of course we'll get there. So just know that the baby is always moving. Many times when people come with all those complain and worry, by the time you check, the baby is just enjoying itself in the little space and water. So it's you that is really not feeling anything, right? A quiet time to pray. They are having their own meditations. Meditation to come on, meditation to see how to give you sleepless nights by the time they come. Right? So somebody has asked the question: when should the movement become regular? When should it? Well, around 28 weeks of pregnancy, doctors will expect that you have daily movement pattern. By this time, you would have mastered the pattern. You should have daily movement pattern. You should have even a recognizable active and quiet periods, right? You just know that this is when my baby is active. This is when my baby is quiet, right? And this is even when kick counting may be recommended. I'm sure the doctor has done that to you before for you to count the kicks. Have you observed? Have you not observed that your baby seems to be active at night and less active in the daytime? So I said the other day, their rhythm is opposite, right? They will kick as though they are at war in the night when you are supposed to be sleeping, then we'll be sleeping in the daytime when you are actively doing your thing, right? So I think that's where the statement a child that will not let the mother rest itself will not rest, because that's the time you are carrying the stomach all over the place, jumping from here to here to the market to wherever, you know. So well, again, you should feel at least 10 movements in 2 hours when your baby is active, right? Just to give you an idea, at least 10 movements in 2 hours. And many babies will actually move much more than that, right? So, because we all do not have the same temperament, even in the womb. Some can kick a million times because they are restless, right? Some others are so gentle, nice, and but just to give you an idea, 10 movements in 2 hours, you can have the baby um, active for that long, right? So what would you mean by a strong kick in the first place? What would you mean by a strong kick? It's very simple. A strong kick basically means healthy muscles. So, of course, I know sometimes when the kick is so hard, you can feel pain, but just know that the strong kick usually will mean healthy muscles, right? It also means good oxygen supply, right? And also means active nervous system, because if the nervous system is not active, it will not be kicking. Remember, I told you every time the nerve cells are connecting to themselves and also to muscles, there's always the movement that happens. So that's what it means. So stronger kick does not mean distress. Does not mean distress. It's always telling you that this is good. In fact, a sudden quiet baby is more concerning than a very active baby. So you should be more concerned that kilo day, why this pikin no gree talk today, right? Right. So you should be more concerned when it has gone quiet, right? And this just brings to mind several sad situations I've faced over the years with respect to what I'm saying. But it's important you understand what I'm teaching you tonight, so that you help yourself before the doctor intervenes. Is that okay? All right. Regardless of how irritating it is, just make sure you 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 understand what your baby is trying to tell you through the kicks. So if we say it should be more concerning if the baby is quiet than when it's active. The question now is, why does the baby sometimes go quiet? Why does the baby sometimes go quiet? 89, 80 something people in the house, please let's tap on our screen. Let's take these likes to 50k likes. If all fingers will be on deck on the screen, we will hit 50k likes in no time. Right? So why does baby sometimes go quiet? If you are here with me and you can hear me, please talk to me in the comment section. Just type I'm here so that I'll be sure that I'm talking to active viewership. And if you have not followed me, question I want to ask is why? Why have you not followed me? Right? Should I cook pepper soup for you before you follow me? Well, you need to follow me because for everyone that will give birth in 2026, wherever you are in this world, I'm coming for your naming ceremony. I will be there. Just tell me. Right? Wherever you are. If you are in Madagascar, I will come there. If they give me visa. Because I'm gonna next year is all about naming ceremony. Because everybody who wanted to be pregnant would have been pregnant. And they will just be hearing congratulations all over the place. Right. So where was I? So if you are those of you in the FYP, I see you. You want to jump in and let's take these likes to 50k. Is that okay? All right. That my friend that said she wants to get pregnant. I hope you are still here. If you are not here, I feel sorry for you because it does not make any sense to just ask question and run away. Ask question and remain so that we can help you. Most of the infertility problem we have in this world is lack of knowledge. It's not really because something is wrong. It's not even village people or mother-in-law problem. Africans, that's our matter. Right? It's lack of knowledge. And I'm bringing you the knowledge now. Right? So next year, tell me, I'm coming to your country for naming ceremony. All right. So let's continue. So why does the baby go quiet? Right? Gold said, can somebody tell her why she's going insane? We already talked about it. I'm sure you're just coming today. A few weeks ago, we talked about first trimester concern. So don't worry, you'll be fine. By the time you get to 14 weeks, you begin to get better. Is that okay? All right. So let's continue. Now, the normal reason why baby goes quiet. Listen, the normal reason why babies go quiet. Number one, my people that are writing. By the time I start talking now, they'll stop tapping. They'll say, oh, it's because I am writing. So while you are writing, be tapping on your screen. So the normal reason why babies go quiet, number one, the baby is sleeping. Right? As simple as that. He's sleeping. You can have that quietness 20 to 40 minutes, right? Sometimes even longer. Maybe sleeping. You right? Reason why some of you run to the clinic, I don't understand what's going on with my baby. Number two, the mother is busy and she's distracted. Busy, you're distracted, you cannot tell whether the baby is kicking or not. So that's number two reason why your baby goes quiet. Right? Number three, right? Now, if the placenta is on the anterior, don't worry about the grammar, it's in the front because placenta locations can vary. So you can have it in the front, you can have it in the back, you can have it close to the cervix and all that. I talked about it the other day when somebody asked me about placenta previa. Excuse me. So if the placenta position is on the front, that is the anterior position, it cushions the kick, right? If the baby is kicking in that direction, it cushions it. So you may not necessarily feel the impact like somebody who has the placenta location somewhere else. So that's another good reason. Good evening. So happy New Year in advance. Good evening, B. Thank you very much. Thank you very much. You don't want to miss tomorrow's discussion. Tomorrow we are discussing. It's a special episode tomorrow. The episode tomorrow is the effect of sugar on male and female fertility. So you want to invite everybody. You know, this is a season where a lot of sugar is consumed. You have it in cakes, you have it in chim chim, you have it in buns, you have it in sodas, you have everywhere sugar. So I'm sure after you are now loaded with sugar, come, let me teach you the effect of sugar on the fertility. So invite the men, invite the women, invite everybody that are trying to conceive. Let them come and learn something. That is tomorrow, Christmas special, right? Then there's also New Year special. I will reveal that tomorrow. You don't want to miss these two all important days. But let's continue. So I said the reason why the baby can go quiet, and the normal reason will include the baby is sleeping, right? The normal reason will include the mother is busy and distracted, not even feeling nothing. The placenta position, especially the one that is anterior, it cushions the kick, right? It cushions the kick. And also the baby position must have changed. Now there are certain positions that gives them leverage to kick hard, and a certain position that does not give them the opportunity to kick hard. So baby's position also matters, right? The baby also have their sleep and wake cycle, which you should know. I mentioned it, just like adults. But the thing is that adults would sleep at night, wake up in the daytime. Babies will sleep in the day and wake up at night. So all the people who have been pregnant, you can agree with me that your baby's activities is usually at night. That's when you start feeling the kung fu. Enough kung fu going on at night. And you want to wonder. After saying all this, right, let's ask the question, what is not a normal kick? When is the kick not normal? Right? If you are in the comment section, if you're here with me, please just type ready. Let me be sure you are there and listening to me. Type ready. Yeah. What is not normal when it comes to baby kicks? What is not normal? And in fact, you should seek medical attention if any of these I'm going to mention applies. Is that okay? Please, let's keep taking the likes up. All fingers on the screen. Let's take the likes up. Is that okay? All right. All right. So you should seek medical attention if you notice a sudden and persistent reduction in the movement. Suddenly, the movement is not the way it is, and you've been waiting, and it seems not to be getting any better. Please, you want to see your doctor. And this, when I say this, it brings to mind the several cases I've had to face of intrauterine fetal demise, where the pregnancy is lost, the baby just pass away after getting this far, right? After getting this far, the baby just passed away. What happened? Hmm. So please, if you notice a sudden reduction in movement and it's persistent, it's time to go and seek attention. Yeah. If you notice no movement is felt for several hours, especially in the time period when the baby is usually active, that should be a source of concern. No movement for several hours, especially in times when your baby is usually active, is a source of concern. If you notice the movement has stopped completely, go and seek attention, because there should be no time in your pregnancy where movement stop completely. Yeah, there should be no time. And if you feel something is not right by reason of your instincts, go and seek attention. And because most times your intuition may just be right, so seek attention. Do not sit at home and I've seen several sad cases. I don't want to begin to mention them because um, I'm usually too attached to my patients, so their case touched me so much, right? That's why I'm avoiding most of you here, right? Because by the time I take up your case, I will personalize it until we get the result. I remember that my dear friend. I don't think she's here. The one that I think the first person that said she was pregnant in December. She was already on her way to considering doing IVF. In fact, I'd already recommended where she should go. Then she discovered she was pregnant. In fact, what I wanted to do was, even though that location was not my location, by the time they are ready to retrieve the egg and do the lab stuff, I wanted to be in the lab to personally see through her case. Well, thank God she became pregnant naturally, and I don't need to trouble myself. All right. So that is how committed I can be with my patients, and that's why when something goes wrong, it hurts me badly, and I'm avoiding all of you. Please go to your doctor. Let your doctor take care of you, so that I will not have too many people to worry about. So, like I said, trust your instincts. Your instincts matter when it comes to your baby's kick. So if he's not behaving the way you expect, go and see your doctor. And yeah, studies have shown that the reduction in fetal movement can be an early sign of fetal distress, right? From what has been studied, the reduction in fetal movement can be an early sign. So that's why you don't want to joke. Don't joke. Please don't joke. All right. All right. So if you understood anything up to this point, can you talk to me in the comment section? Just type understood. All right. Just type understood. All right. All right. So you know that if you report to your doctor that you you are noticing reduced movement, the things your doctor will try to do will be, they'll try to listen to your baby's heartbeat using the fetoscope, right? All the pregnant women here already knows what I'm talking about. You try to listen to your baby's heartbeat, because heartbeat is the is the basic sign for viability. No heartbeat, no life. Is that okay? Now, besides that, an ultrasound will be performed. Sometimes when they don't even understand the what they are hearing, they send you for an ultrasound where we measure the heartbeat. And also the amniotic fluid will be checked. The amniotic fluid will be checked. If you were here yesterday or the day before yesterday, we talked about amniotic fluid, how that is also essential for the function of your baby's internal structures like kidneys, like digestive system and all that. So check the amniotic fluid, yeah, and also there will be the monitoring of the blood flow of your baby, right? Often times everything will be fine, but checking it early will save lives. That's why remember your anatomy scan. Hmm. A stitch in time saves nine, they say, right? So you don't want to play. You see, you know why monitoring these babies' movement matters. You know why it matters? Right? It matters because uh, global data have shown that when you are aware of the fetal movement being reduced, right, it will help you. In fact, what has happened, the awareness of that fetal movement reduction has helped us to salvage the situation long before anything happens, right? So we have reduced stillbirth rates, reduced stillbirth rates when proper monitoring is done, when adequate monitoring is done. That's why I'm giving you the details now for you to play your part. It's not everything your doctor can do for you. Your doctor don't sleep in the same house with you. So when you notice any of these things I'm saying, you can now go and seek for help. Is that okay? Um, Early reporting will prevent any complication that can happen. So when you report early, complications can be mitigated before they even happen in the first place. Right, then simple things they teach you in the antenatal will save lives. In fact, it will even lower the the cost of what you would spend if there was a complication. So that's why you must take your antenatal seriously. Your baby's movement is your baby's voice. They don't talk, but they talk through the kicks, push, stretch, and rolling. Right. So that's how your baby talk to you. So you will notice when you talk to them, they hear your voice, they kick. So it's their way of responding to you. Is that okay? Is that okay? Upward to this point, did you understand anything? Just type understood. Let me be sure you understand something. Um, if you are not following me, please follow me now. Tap on your screen, share the live. Right? And if you have not dropped a heart me, why are you like this? Lolo Senator, I see you. Thank you very much. If you have not dropped a heart me, why are you like this? As good as the information is, don't worry. You'll get it somewhere else and you'll pay heavily for it. Right? Let's go on to the next thing. Is that Steven? Steven is here. Hello, Steven. How was your day? Good to see you. Good to see you. You're welcome. Let's move on to the next thing. And the next thing we want to talk about is the factors that will affect how your baby kick will feel, right? Factors that affect how kicks feel. I mentioned about one or two before, but I want to emphasize it, right? So the first thing I mentioned before was the placenta position. And I said that if it's on the anterior, that's on the front, it's the placenta cushions the kick, right? It reduces the sensation you feel when the baby kick in that direction, right? And also mother size will affect how you the baby kick is felt. Yeah. um should I say, you want to compare orobo and lepa? Yeah. So if you don't understand, I'm sure those of us in Nigeria understand what I just said. So the rest of you, just the mother size will affect how the baby kick feels. Is that okay? Now, baby position also, and I said earlier that there are certain position that the baby takes that does not give them the leverage to kick so hard, right? So it also will affect that. Even the amniotic fluid that's surrounding them. Yeah, if you have reduced amniotic fluid, it's equal to reduced space. Much amniotic fluid is equal to enough space to throw punches, stretch out, roll 360, and whatever the case may be, right? And also the time of the day. PP, I see you. Good day. The time of the day. You know that babies often move more at night, I mentioned before. So the time of the day will also determine how it feels. So why some of you will feel some agonizing kick at night when you're supposed to sleep. In fact, this baby will not allow the mother to sleep. Right? Kick is always tougher at night than in the daytime. Right? Now, some people have said that too much movement means the baby is stressed. It's not true. Too much movement is not equal to baby is stressed. No. Some others will say movement will stop when the baby grows bigger. Also not true. Also not true. The reason why you are feeling less is because they don't have enough space. So it does not stop. Right? Some will say only the kick would. And by the way, for those of you whom your doctor will ask to go home and count the baby kicks, this is wisdom. And not even wisdom, this is knowledge. Now, what count as a kick? What count as a kick? Right? Whether you are feeling a punch, a kick, an elbow, a head boot, or rolling, all of them count as a kick. Because some people will only be counting the punches and the kick. They don't count the rolling and any other thing. So knowledge has come. So you want to count properly moving forward. Is that okay? So like I said, rolling, stretching, and pushes all count as baby's movements. Right? And you can imagine the kind of things we see on ultrasound screen of the kind of movements. I wish we have a green screen that moves, video green screen. I would have been able to play some of those things for your viewership, right? And again, also understand that babies will remain active until birth. There is no one time they are not active. If they are not active, something may just be wrong. Besides the time they sleep anyway. But if they are not active, something may just be wrong. It's either their reflexes are poor due to poor nerve development, or there is a demise. There's a demise. All right, good. Now knowledge has come to you. Congratulations. So before I start taking questions, can you feel kicks in 14? You will come up and ask the question. So before I start taking questions, let's quickly help us understand the long story short, right? Baby kicks are a sign of life. That's why I told you, if you feel if you don't feel the kick, you should be more worried than when you feel the kick, right? The baby kicks are a sign of their growth and also their reflexes, development of brain, of nerves and muscle connection. All right, the baby kicks are a sign of communication. They don't speak with their voices, but they can speak with their kicks. So it's a sign of communication. So you don't need to um, count every kick. All you just need to know is that your baby has a normal pattern, right? Otherwise, you'll be counting from now till forever. Just understand the pattern of your baby, and you know what's up, right? So I hope that is clear. So if up until this point you understood anything, just type in the comment section clear so that I will know you are there. And if you understood anything or you have any question up until this point, this is the time to send in your request. Come up the box, ask your question,